Hi everyone, I'm Ilona Varo, licensed marriage and family therapist and mastery method coach, and I'm going to be joined today in a little bit by Dr. Jennifer Keagle, and we're going to be chatting all about mental health and plastic surgery and how the two intersect. So I'm going to just wait a couple minutes for people to join and for Dr. Jennifer to join. And if you have any questions, it's sometimes hard for me to track in the messages, so please use the question mark feature down at the bottom if you have any questions. But really, we're going to talk about a whole variety of things that go into someone making the decision to get plastic surgery, and then how to make that decision, and then also things to be mindful of that might arise after the fact. It's a very personal decision, obviously, and you want to make sure that you're in good hands and that you feel confident and comfortable with the provider that you're going to be working with. So we're going to really get the doctor perspective, the therapist perspective, and just be sure to keep things in mind that come up along this journey. There's a lot of anxiety, there's a lot of fear, there's a lot of pressure that people feel. So we really want to be mindful when going into any kind of physical transformation to be aware of the things that might come up that we might not have even thought of. So that's why I'm really excited to have this conversation so that we can really get both perspectives and also talk about what we've seen and our practices as well. So again, if you have any questions, please use the question mark feature. I have some pre-submitted questions as well. And we're just gonna wait a couple minutes. There she is, amazing. Okay, we're gonna start in 2 seconds. It's been so long since I've done an IG Live, so I'm really excited to be back and feel energized. I think the last one I did was last year, so it feels good to be back. And now we're gonna start doing a lot more of these. I see that you're there. I see that you've requested. Okay, perfect. Good old technology.
Hello.
Hi. You're sideways for me.
Do you want me to go the other way?
Yes, please.
Oh, please.
Yeah.
There we go.
Amazing. Thank you so much for giving us some time and joining us today.
Hello. Thank you for having me.
Yeah, I'm so excited. I've had a lot of people write in. We've got some questions queued up. I just mentioned people can add questions into that little question mark box down at the bottom if anything comes up during our conversation. But I'd love for you to just kind of give us a quick little intro of who you are and your specialties, and then we will get into the nitty gritty.
So hi, thanks for doing this. So excited. Jennifer Keagle. I am a plastic and reconstructive surgeon in Northeast Los Angeles. I did a lot of training. I did a full general surgery residency at UCSF and then did plastic surgery there as well, and did a craniofacial fellowship at UCLA. And my practice is aesthetic slash cosmetic and reconstructive. And I also do cleft lip and palate as a secondary thing in Boyle Heights. And I also do adult cleft in my private office, but mostly a lot of breasts, faces, noses, liposuction, mommy makeover, that kind of thing.
Yeah.
So
Yeah.
is that good enough? I hope that's good
Yeah,
enough.
no, that's perfect. That's perfect. So I was just sharing a little bit for the audience that there's a lot of mental health things that come up when you're going through physical transformation. My philosophy has always been mind-body connection, how the mind affects the body, how the body affects the mind. I'd love to hear a little bit about the things that you see patients present with, specifically more psychological things that you notice as they're requesting or asking for physical improvements.
I mean, that's a great question, and it's multifactorial answer, but
Yeah.
I mean, I'll try and keep it as short as possible. First of all, when a patient comes in and wants something done, we're partners. So I can do my part, but they have to do their part. And also, it is a mind-body thing. You have to be able to take care of yourself after surgery. You need to be able to follow directions. That just step one. But, we're trained as plastic surgeons to kind of see the red flags, body dysmorphia, that type of thing. But I think it's so interesting that you point out, when you change the outside, the inside changes too, or fails to change slowly. So sometimes I find people remember their first look after they get their dressings off and they don't see the change after that, and they have their head stuck in that initial look. So I think that's a very important part of it. I hope that answers your question.
Yeah, yeah, absolutely. I think from where I sit, I usually have the conversations around disappointment and expectations and having these high hopes that after surgery they will feel a certain way about themselves and that it isn't such an automatic change. How do you prepare someone? What are questions that people should ask when they're going in for a procedure to really have that understanding that it's not just there's always downtime, there's always recovery, there might be tweaks that have to be made later on. How do you prepare someone, and what are questions that someone should ask their doctor so that they feel well prepared?
I mean, I think my job is to ask them the questions and see where they are. We need to have mind meld here, so even just easy things like, I can't guarantee a cup size, but you tell me what you think the cup size is, but bring a picture in so we can see that the cup size, like a C cup, is in my head the same as what yours is. And also, I'm like more of a negative Nelly than like, oh, you're going to look amazing. I'm like, this could happen and this could happen, and we may not do this and we can't do that. So we go over everything before surgery. And I like to just really have all of the, possible complications, what could happen next, all that stuff, done ahead of time. And I like them to bring in wish pictures so that I can say, not so I can match it, but this is a realistic expectation. And this is how long it's going to take to get to that if we do.
I love that. Do you think there's a question that people forget to ask their doctors?
Well, I think there's a lot of questions that don't get asked to people who, well, in general, you should ask your doctor, are you a board certified plastic surgeon? Because there's cosmetic surgeons out there that are way different than plastic surgeons. I went through my list of training, it's up to 10 years of what I did, and you have to be board certified. You need to be a member of the American Society of Plastic Surgeons. I'm also a member of the American Aesthetic Society. You need to make sure that your person is not just, a cosmetic surgeon. We do cosmetic surgery, but we do aesthetic surgery. It's the same thing, but we're board certified. I think that's number one question.
Okay.
I have a lot of people ask about pricing and base their choice of doctor on that. And that, I mean, I have my own feelings about that, and that's not getting into the mental stuff, but I really think you need to not base it on price,
Yeah. Yeah, I know that's such a tricky area, but it's so important that I feel the relationship has to be there. You have to feel safe. You have to feel like you can be transparent with this person. You can talk about your fears, your worries, your anxieties, your hesitations, not feel pressured by the provider. The relationship, even in therapy, is always the number one most important thing. Yes, absolutely. The training, education, experience is very, very important. But right below that is that personal
You got to
relationship so
like
that you feel like,
each other.
yeah,
If you don't like each other, what's the point,
yeah,
right?
yeah, absolutely. A question that came in when I first posted that we're going to be having this conversation is how much value should someone put into before and after photos when they're making a decision around choosing a surgeon? Is that a good way to decide? Like, oh, they have really great things posted on social media, or what are things to look out for?
Well, once again, cosmetic surgeons put a lot more on social media sometimes than board certified plastic surgeons. I'm okay with looking at before and afters, but I think I don't do imaging because of kind of that situation, because I don't want you to get stuck in your head. You're going to look exactly like the computerized
Yeah,
image. And then if you don't, you're disappointed and sad. And we don't want you to be sad. We want you to be, pleased with how you look, how you breathe, how you back feels, all the things.
yeah,
So it's a yes and no. I mean, if I was looking for a surgeon before and afters, I don't know if I'd do it, but some people really like it. And if that helps get their head around the situation and helps them get through things, that's totally fine.
Okay. So it's not a huge red flag if there's a ton of before and after photos. Like that's typical. That should be expected.
No, I mean, a ton is an issue sometimes, but no, I like them to show me what they like so I can see if it's realistic and to talk about what it's going to look like later and how they're not going to look like that or they are going to look like that.
Yeah.
A gazillion photos. More of a red flag is more if you're doing a nose, a rhinoplasty, even just for breathing, and they say, I don't want it to look any different. That I've learned is a huge red flag because even if you fix it for breathing, it's going to look different. So that has become a kind of universal red flag for me.
Yeah. Yeah. Absolutely. And I was just looking off to the side, looking at the question. So I apologize for breaking eye contact. Um, there was a question about how to keep expectations realistic.
Yeah, I mean, I think that's a real tough one. I mean, I think that's where we work together. As I said, I really lay it all out, this, and this, and you may need a second surgery. Sometimes with breast reductions, the breasts are so big, and I'll say, I will try and get you where you want to be, but you may need a second reduction because, it's just not possible to achieve it in the first round.
Yeah.
So the beauty with plastic surgery is that we can always redo something, but people don't want to deal with that. I get it.
Yeah.
So realistically, like I said, I say, what does this look like to you? And then even looking in a mirror, yesterday I had a facelift patient. She said, my ears are so much bigger. And I said, well, they don't look big to me. Look in the mirror and tell me what big is to you. And it was length, one was longer than the other. So you really have to dive in because people have different education levels, different everything. Everybody's different. So what does this mean to you and how do I understand that better?
I love that. I love that. I guess I've never really heard doctors, speak in this way. Certainly from therapy, we're all about meaning making. And so I can say the word chair and what I'm thinking and you're thinking is totally different. Right. So I love that that's a big piece of the conversation that you're having and you need to have is to really clarify and make sure that you're understanding and meaning the same thing, not just saying the same word, but really there's an understanding between the two of you.
Right. Exactly. And, sometimes you get together and you get the meaning together and then post-op they completely forget. And you have to say, remember, we talked about that? And sometimes they don't, because it's a lot. It's very, very overwhelming.
Yeah.
I like to write everything down, not expectations, but more instructions, because then you have something to kind of get a handle on.
Absolutely.
And that helps with the anxiety. Then you have some control over something, then you're my partner because we're doing this together.
Yeah. I love that. Yeah. Another question, how does someone know if they're headed into a procedure for the right reason?
I mean, that's a great question. I mean, our consultations are at least an hour and we talk a lot and you can kind of get a sense of what the goals are, I mean, if someone else is paying for it, it's always a little, I've had like fiance bring in the woman and then they want to decide the breast size. Well, that's not happening. That's your body, you decide. So, I mean, it's a whole kind of array of things, but I think just chatting and getting to know the person is a huge thing.
Yeah. Wonderful. There was a question that came in. How do you know when enough is enough? How do you help someone navigate that?
I mean, that's a very personal thing. I am a meanie and we are on the east side of town, so things are way less acute and overdone over here. People don't want people to know things were done anyway. I've said no a lot, because that's my name on your face, body, breast, and I can't do that. That's not okay. But there's a lot of people who will say yes, yes, yes. So I think at some point you have to realize everybody has these folds, like don't get rid of them completely. Otherwise, I mean, I'm just more of a natural look type of doctor, so I think it really depends, if it gets to be, I don't think there's an addiction to Botox or any of this stuff. that's not such a thing in my opinion. It's just, you do what's right for you, but don't lose sight of what you should look like appropriately for your age.
Yeah. And I think with the enough is enough conversation, I think that's where the mental health piece really comes in is,
What's your opinion on that? Yeah.
yeah, like that is where you're having conversations, hopefully, and processing what's driving the desire and what is the perceived outcome and how do you think it's going to impact your relationships and your life and your self-confidence and your self-worth. There's so many elaborate directions that conversation can go, but it needs to be more than just an impulse of, yeah, I think I'd like to get this done and now that done. And it's kind of that, when you buy a new pair of jeans, now you need a top to match it. Now you need the shoes to match it. It's just kind of like constantly, it's a spiral. It just spirals out of control unless you're really grounding. What is this doing for me? How does it make me feel? Is it aligned with my values, who I perceive myself to be? Is it for someone else? Like you said, is it to please someone else, or is it really an internal desire? There's just so much conversation that I think needs to be had. And that kind of leads into my other question. How long typically is there a waiting period between deciding to have a procedure and actually having it? Do you, I know you work with people, 18 and over. Do you have a different kind of maybe waiting period for someone who's younger to really make sure they understand the impact of this?
That's a great question. Well, actually, I'm a pediatric plastic surgeon, so I work from 0 to very old. And, there's certain things like I'm going to do a reduction on a 16-year-old, but I think very, very long and hard. I make sure they get clearance from their therapist and their psychiatrist, because I want to make sure it's going to be okay and that they understand when you're older, you may need another operation, such like that. That being said, there are people who want something done and they are fast decision makers. That I'm that person. So if they want surgery in a couple of weeks, we can do it if it's reasonable. They always come back for a pre-op visit so we can go over where I lay all the crepe and we go over everything and scare them a little bit. And they have to get clearance from their medical doctor. They have to, all in all, we have to be safe. I have to be a real doctor, So we have steps to go through. We don't just go, okay, today you get the breast aug, But if they want filler, Botox, if I sense they're having any concerns, they can always come back. I'm not going to force. I never would force anybody to do anything. That's not necessary.
Yeah. Great. Yeah. I mean, I think as with everything, patience and introspection goes a long way.
Right.
So if there's this impulse and need and have to have it now, I think for me, that's usually a red flag of, okay, let's pause.
Yeah.
If you're clinging to something so tightly, that is the signal to hold on, release, surrender, and let's look at what's really happening instead of just buying into the impulse and the urge. Yeah. And that is, like you said, very different than someone who is clear and grounded and is naturally, someone with more conviction or has more of a decisive nature. That there's totally a difference. But I guess you really have to be aware and attuned to the patient that's sitting in front of you. Maybe, do you have a history on them, or, are you just kind of like meeting someone for the first time and just taking at face value? How does that work?
Well, I mean, we have, even for Botox, fillers, peels, whatever, we have a full medical history. I mean, we get the whole history. It includes psychiatric history, what meds you're on, anxiety, depression, all that stuff. So I know what you're on already. I know your medical history. And it's just talking to people and kind of getting a sense. I mean, the thing with surgery is you can't just jump into surgery the next day. There's a schedule that's filled. And, as I said, there's other things to jump into. So there is that waiting period,
Great.
I mean, it's built in. But fillers, Botox, all that stuff. I mean, all that stuff is temporary too. You could always dissolve fillers. Botox goes away. There's a certain number of months. So, and I always start kind of slow anyway, because I don't want people to get overwhelmed if it's their first time for getting, non-invasive stuff.
Great. I know. I always, less is more, because you can always add.
Exactly.
Yeah. Let's see if there's anything else.
I mean, that being said, if I can add one more thing, plastic surgery is not, what everybody thinks it is in the media. It helps you with, it doesn't change your life, but it does give you some confidence, and it can it can really enhance normal human beings' lives. Heavy breasts, small breasts, asymmetric breasts, nose, breathing. It really is just that little tweak, and it can really change your life, but you have to mentally be prepared for it, even if you are the most stable human in the world. It's a lot.
Yeah. Yeah, absolutely. I mean, just navigating the emotions as well as the physical healing and getting used to now seeing yourself in the mirror. It is very emotional, even
Mhm.
if it is something that you've been looking forward to your entire life and you've wanted this and now here's the change. It's pretty classic, and we expect even positive change is uncomfortable for people. It takes
Yeah, right,
any change, not just bad change, but
right,
unpleasant change and pleasant change are also registering as something new and uncomfortable and something that your brain has to now adjust
right,
to. So I always tell my clients, expect discomfort, even though emotional discomfort, even though it's something that you think that you've wanted your whole life and this is going to, make you so happy. Still be prepared for the fact that it's a transformation, it's a change, it's going to require emotional adjustment as well.
yeah. I mean, thank you for writing that. I see,
I see
Katie.
that comment.
Um,
I'll just read it
but
too. Someone wrote in that they had a breast reduction from you and it was completely life changing. The comments go away after this is posted. So I just wanted to affirm that. And I've had people messaging me also that they've had, yeah, your work done and they've just had wonderful experiences and really great outcomes.
oh, that's so sweet.
Yeah.
Thank
Yeah.
you.
Yeah.
Yeah, no, I mean, it's not. I became a plastic surgeon because I had my nose done when I was 16, and it wasn't the most dramatic thing, but I was so uncomfortable with how I looked, and just a little bit really helped me just improve the way I felt about myself. Now, don't do it to make feel better about you know what I'm saying.
Yeah.
But yeah, I mean, it can really change someone's life, but not in like the way the social media or movies make it you believe
Yeah.
it.
Yeah. And that brings up such a good point because it's very contradictory and has a lot of paradox built into it. But I'm such a proponent of self-acceptance. That is absolutely such a huge piece of the work that I do. And that doesn't mean you have to never do anything to alter your appearance, or you're not allowed to do this or do that. Like, they can both coexist. It's not just you have to accept yourself exactly, as you are, or it's not mutually exclusive. You can certainly practice self acceptance and do things, as small as coloring your hair to, on the other end of the spectrum, having plastic surgery. It's not something to be ashamed of or to have stigma around. It's a tool to help you feel a certain way and to express yourself and to feel more, aligned with who and how you see yourself to be. And it's not the end all be all thing that's going to now solve all your problems. So
Right.
it's such a
Perfectly put.
paradoxical.
Yeah, I love that
Yeah.
because it is empowering. Getting surgery, whatever, even coloring your hair. You're right. It is empowering you to express you. But as all things, there are extremes, and you don't want to get to that extreme. But I mean,
Yes.
thankfully, we don't see that over on this
I
side
know.
of town.
Oh, it's so funny. It's so, so funny as you start moving east. It's just a different
Yep.
different experience. And
Yeah.
so that's the beauty. There are practitioners out there that will listen to you and be on your same page and make sure you feel comfortable and you're doing changes that are not so drastic that you're going to wake up and look in the mirror and think, who am I? But it is a process and you're well informed, and your practitioners are making sure that you're also taking care of the mental health side, the emotional side, that identity shift that is happening. You really want to nurture that so that it's not a shock to your system in any way.
Correct. But on the flip side, there are people who, even though we think it's a very natural natural, not overly crazy change, some people feel that way still, and it takes a minute for everything to converge.
Yes.
And sometimes they're still there, and it's very hard to get those two to converge. And that's where sometimes some body dysmorphia rears its ugly head after surgery, even though it was not detected before surgery.
Yes. Can you say a little more about that? I think that's so important.
I've had it where people get the image, usually their first look, and things will drop, swelling will go down, but they have it in their head that they look exactly like they looked after surgery. And then they can't get it converged that it's not. And you'll show pictures, and say, look, the only difference is your nose is straighter, or, you look like you still. But it gets very concerning when there's massaging 100 times an hour, or looking at pictures nonstop, or sending pictures, or just pointing and saying, don't you see? And I'm like, I can't, I'm sorry, I can't see, and I wish I could, but I can't. And that's when you come in.
Yeah.
And we
Absolutely.
try and not operate on people where that's going to happen, because that's probably so uncomfortable for them,
Of course.
mentally and physically. But it does happen sometimes, and that's where I will send them to you or someone like you, because it's something's going on.
Yeah, absolutely. And as Bessel van der Kolk put it, the body holds the score. There's so much in our body that, like you just pointed out, it might not come to the surface until there is something that happens to your body that now all of a sudden might bring up either childhood memories or a trauma, or it could be such a variety of different things, or all of a sudden someone sees you differently or relates to you differently, and that's triggering something emotionally or psychologically. So
Right.
the big picture of all of this conversation is that the mind and body cannot be treated separately. They
No.
have to be seen as a whole, and both things need to be treated equally.
Agreed.
Yeah.
And I wish we could predict it ahead of time, but sometimes I can't.
Yeah, of course. Yeah. Well, thank you so much. I think we covered all the questions that came in. Where can people find you if they would like to reach out for more?
Oh, drkeagle.com. It's KEAGLE.com. We are in Northeast LA. We're in Glass Hill Park, which is near Eagle Rock and Highland Park. And you can find us on Instagram and all that fun stuff.
Perfect. And I will tag you so that people can find you directly from this conversation. And I always like to ask my guests, what is their favorite form of self-care? That is kind of the note I like to end on.
I mean, I do all the things, that are, the massage and the mani-pedi and that type of thing. But I also think self-care is more just like sitting quietly and trying to just figure out what's going on with you. And that's the hardest part of self-care for me, I have to say.
Being with yourself.
Yeah.
It's very
I do all the things.
Yeah. Yes.
Yeah.
We love to be distracted. So I appreciate you saying that.
Yeah.
That is so important to give time for you versus you, just being with yourself. I love that.
That's right.
Well, thank you again so much. I really
love
appreciate your time.
So fun to talk to you. So great. And I look forward to collaborations in the future. It's just
absolutely.
Yeah.
Absolutely. Thank you so much. Have a great day.
All right. Bye-bye. Thanks.
Bye.